Welcome to Fertility 1-to-1. The intention behind Fertility 1-to-1 is to take one topic around IVF and infertility and discuss all the possible questions that a patient might have and get their response from an expert. Sitting with us today is Dr. Gajendra Singh Tomar. He practices IVF and infertility at Indore since last 18 years. Today's topic is IVF with Donor Egg Program or IVF with oocyte donation. So let us take about roughly 25 questions on IVF with Donor Egg Program and get the response in short, crisp and easily understandable fashion from Dr. Tomar. So starting with the first question. So doctor, what are the indications for IVF with Donor Egg Program, or when do you think a couple should consider IVF with Donor Egg Program?
So IVF with donor eggs or IVF with donor oocyte program is usually considered when the woman herself has no oocytes or limited oocytes. This condition is known as diminished ovarian reserve, wherein even upon stimulation of the ovaries we do not get viable oocytes. This usually is associated with either an advanced maternal age, wherein the AMH levels are low and the antral follicle count is also low on ultrasound. In some genetic disorders, wherein there's a possibility of the genetic disease being passed on to the offspring, in such cases, in consultation with the geneticist, in some cases oocyte donation is also recommended. Apart from advanced maternal age, there might be some surgical indications for oocyte donation as well. For example, if there's some pathology which has necessitated the removal of ovaries, in that case also oocyte donation is recommended. In certain cases where cancer of the ovary has been diagnosed, because of which the ovaries have had to be removed and the female has not undergone fertility preservation in the past prior to undergoing removal of the ovaries, in those cases also oocyte donation will be required. So there are some cancers in which, although the ovaries may not have been removed, but radiation or chemotherapy might have had to be given to completely cure the disease. So example, in cases of bowel cancers or cancers of the uterus or vagina. So in those cases, because of irradiation and chemotherapy also, the ovaries cease to function, and in those cases also oocyte donation is recommended.
So doctor, how many attempts of self-cycle IVF or trying IVF with your own eggs, how many attempts should a couple consider before they actually think about an IVF with donor egg program? Is there a limit or minimum number of cycles or something like that?
So there's no such limit. If upon stimulation, if you get a good quality embryo, then there's always a chance of getting pregnant. But if on repeated stimulation, in spite of repeated stimulations, if you're not getting good oocytes, good quality oocytes resulting in good quality embryos and blastocysts, then there's no point in doing the same thing again and again. So there's no such thing as a minimum number of cycles that you have to undergo. You can, even after one stimulation cycle or even before attempting your own stimulation, you can opt for oocyte donation or egg donation, and that should be in consultation with your fertility specialist.